For countless men, that first cup of coffee is a non-negotiable start to the day. It's a ritual, a comfort, a necessary jolt. But what if I told you that while you're carefully measuring your grounds, there's a crucial part of your health routine you're likely overlooking, something that profoundly impacts your daily energy, your fundamental confidence, and even your simple ability to use the bathroom without strain or worry. This isn't about adding another complex task. It's about recognizing the subtle signals your body sends and responding with small, powerful actions. Hi, I'm Dr. Lucy Stone. As a urologist and men's health specialist with over 3 decades of experience, my life's work has centered on helping men, particularly those navigating life beyond 60, reclaim their vitality and fiercely protect what truly matters: their independence, their dignity, and their enduring health. The penis is often dismissed, relegated to the background of getting older, seen as just another body part winding down. The profound reality, backed by extensive research and clinical observation, is that it acts as one of your body's clearest, most honest dashboard indicators. Its condition speaks volumes about your cardiovascular system, your prostate health, your hormone balance, and can even offer early warnings for conditions like diabetes. And that crucial window right after you wake up? That's when it's communicating most directly. Ignoring these quiet signals isn't just about sexual health. It's about ignoring vital clues to your overall well-being. This isn't about fear-mongering. It's about empowerment. In the following paragraphs, I'll guide you through 7 specific, practical, and scientifically supported steps you can seamlessly integrate into your morning routine. These steps are designed to enhance circulation, prevent long-term tissue damage, support sexual function, and ultimately, give you back a profound sense of control over your body and your life. And please, pay special attention to step 6. It's the one most men skip without a second thought, yet it's frequently where we detect the earliest, most reversible signs of trouble. Addressing it promptly could unlock years of improved function, renewed confidence, and greater daily comfort. Before we delve into these essential practices, I genuinely encourage you to consider subscribing to channels or resources dedicated to men's health. Staying informed with credible, tailored advice is an investment in your future self. If the insights shared here resonate with you, a simple comment can let me know this information is valuable. If something misses the mark, feedback helps refine future guidance. Your journey matters. So, let's begin with the very first, fundamental action every man over 60 should prioritize the moment consciousness dawns. It requires less than a minute, but lays the groundwork for proactive health. Step 1. The essential morning inspection. Look before you leap. I understand this might initially feel awkward or even strange. Culturally, many of us grew up in eras where men simply didn't discuss these things, let alone examine themselves with intention. There might be a whisper of embarrassment or a sense of it being unnecessary. But after 30 years in urology, examining thousands of patients, I can state unequivocally that consistent self-observation is one of the most powerful diagnostic tools available to you. It's not about judgment or shame. It's about cultivating awareness and respect for your own body. Why is this so critical? Many serious urological conditions manifest visible changes long before pain or significant dysfunction arises. Skin cancers like penile carcinoma, infections, bacterial or fungal, inflammatory conditions, such as lichen sclerosis, minor injuries, or unusual growths often present subtle early signs. Unexplained redness, persistent swelling, unusual bumps or lesions, changes in skin texture, unexpected discharge, or alterations in color. Recent dermatological research emphasizes the importance of regular self-skin exams for early cancer detection, and the genital area is no exception. A 2022 study published in Urologic Oncology highlighted that men who performed regular genital self-exams were significantly more likely to identify early-stage penile cancers, leading to less invasive treatments and vastly improved survival rates. Think of George, a vibrant 67-year-old patient of mine. During a routine visit, he casually mentioned a small patch of persistently dry skin on his penis he'd noticed during his morning routine. It wasn't painful, just there. Because he caught it early and mentioned it, we were able to biopsy it promptly. It was a very early, highly treatable precancerous lesion. Simple, localized treatment resolved it completely. Had he ignored it, dismissed it as just dry skin, or felt too awkward to look or speak up, the story could have been tragically different. This underscores the power of familiarity. The more accustomed you are to your body's baseline appearance, the quicker you'll notice even minor deviations. For uncircumcised men, this inspection holds an extra layer of importance. Gently retract the foreskin and visually check the glands, head, and the area underneath. Look for the same signs: redness, swelling, discharge, sores, or unusual textures. Use this moment for gentle cleaning too. Just a quick rinse with water is often sufficient. We'll cover cleaning in detail later. Don't rush. It truly is just seconds out of your morning. Frame it mentally not as a chore, but as smart, responsible self-care, like checking your car's oil before a long drive. It's an act of respect for your body and your future well-being. Integrating this simple habit fosters a powerful sense of agency. It transforms passive aging into active health management. Once it becomes routine, the awkwardness fades, replaced by the quiet confidence of knowing you're taking charge. Now that you've visually checked in, let's address what you consume before you even head to the bathroom. This simple sequence shift leverages basic physiology for significant benefit, particularly for pelvic and urinary health. Step 2. Hydrate first, urinate second, priming your system. Like most people, my ingrained habit for years was to stumble straight to the toilet upon waking, driven by that undeniable morning pressure. It seemed logical, almost automatic. However, observing patterns among my older male patients, particularly those maintaining excellent urinary flow, energy, and continence, revealed a consistent, counterintuitive habit. They drank water before relieving themselves. Initially, it might seem paradoxical. Why add fluid when you already feel full? The science behind it, however, is compelling. After 7 to 8 hours of sleep without hydration, your body enters a state of mild but significant dehydration. Your blood volume decreases slightly, becoming thicker and more viscous. Circulation, especially to peripheral areas like the pelvis and genitals, slows down. Your kidneys are conserving water, concentrating urine, which can irritate the bladder lining. That first glass of water, ideally 8 to 12 ounces of room temperature or slightly warm water, acts as a gentle system wake-up call. It signals your kidneys that fresh fluid is arriving, encouraging them to release the concentrated urine they've been holding. More crucially, it begins rehydrating your entire system, including pelvic tissues and blood vessels. Improved hydration immediately thins the blood, enhancing circulation. This boost in blood flow is vital for erectile tissue health and overall pelvic organ function. Think of it as priming a pump. You wouldn't try to start a dry engine after it's been sitting cold all night and expect smooth operation. Rehydrating first provides the fluid base your body needs to efficiently flush out waste. Many patients who adopt this report noticeable improvements within weeks. A stronger, less hesitant urine stream, reduced straining, fewer urgent or frequent bathroom trips later in the day, and often, more reliable morning erections. It directly combats the sluggishness caused by nocturnal dehydration. I keep a glass of water beside my bed. Before my feet touch the floor, I sit up and drink it. It's become as automatic as breathing. Try it consistently. Your bladder, your prostate, and your pelvic circulation will thank you. This simple act sets a tone of nourishment and support right from the start. Your internal systems are now gently awakened and primed. Next, it's time to get your blood moving externally, specifically targeting the pelvic region where circulation naturally slows with age and inactivity. Forget strenuous workouts. This is about gentle, targeted movement. Step 3. The 60-second pelvic warm-up, igniting circulation. I confess, I wasn't always a believer in morning stretches. It seemed like something reserved for athletes or much younger individuals. However, as I entered my own later years and witnessed countless male patients, The connection between morning stiffness, poor circulation, and declining urogenital function became undeniable. That familiar creakiness isn't just in your knees or back. It reflects a systemic slowdown, including blood flow to your lower body. The penis is fundamentally a vascular structure. Healthy erections depend entirely on robust, rapid blood flow into the spongy tissues. Urinary function relies on good blood supply to the bladder and pelvic floor muscles. After hours of stillness during sleep, especially as we age and vascular elasticity decreases, circulation to the pelvis and genitalia diminishes significantly. This isn't just about sexual performance. Poor pelvic circulation contributes to tissue atrophy, weakened pelvic floor muscles, crucial for continence, and general discomfort. Recent research in vascular health and aging consistently shows that even brief bouts of light activity significantly improve endothelial function, the health of the inner lining of your blood vessels, essential for dilation and blood flow. A 2023 study in the Journal of Sexual Medicine demonstrated that men who engaged in brief morning movement routines showed measurable improvements in nocturnal erectile activity and subjective reports of urinary flow compared to sedentary controls. The solution: a mere 60 seconds of simple, targeted stretches upon standing. No need for contortions or sweating. Stand steadily beside your bed. Take a deep breath in, raising your arms slowly overhead, stretching gently. Exhale slowly as you lower them. Then, gently twist your torso side to side, letting your arms swing loosely. Follow this with gentle knee lifts, marching softly in place, focusing on engaging your core and feeling the movement in your hips and groin. Finally, try gentle pelvic tilts, rocking your pelvis forward and backward while keeping your knees slightly bent. The goal isn't intensity, it's mobilization. This brief routine wakes up your nervous system, stimulates blood vessel dilation in the lower body, and delivers oxygen-rich blood to the pelvic organs and genital tissues. It warms the engine. Patients who consistently perform this report feeling more alert, experiencing less urinary hesitation, noticing stronger morning erections, and feeling a general sense of pelvic awakeness that persists. It's a small investment for a significant circulatory payoff, setting the stage for better function throughout the day. With your blood now flowing more freely, it's time to tune into one of your body's most honest, yet often ignored, health reports: the morning erection. Step 4. Decode the morning signal, your erection as a health barometer. This is often the point where discomfort arises, or deflection through humor kicks in. I get it. But as a clinician who has discussed this with thousands of men, I urge you to move past the awkwardness. Your nocturnal or morning erection, nocturnal penile tumescence, NPT, is not a trivial event. It's a complex physiological process and a remarkably sensitive indicator of your overall systemic health. It requires healthy nerves, robust blood flow, balanced hormones, particularly testosterone, and a well-functioning cardiovascular system. It's essentially a nightly stress test for your body's core systems. You don't need a spreadsheet or daily logs. Simply cultivate awareness. Upon waking, take a mental note. Did I have an erection this morning? Was its firmness comparable to what I recall from the past? Did it subside quickly or linger? This isn't about performance anxiety. It's about recognizing patterns. Consistent, firm morning erections generally signal that your vascular, nervous, and endocrine systems are functioning well together. A noticeable decline or absence, especially if persistent over weeks or months, warrants attention. It can be one of the earliest signs of cardiovascular disease, often preceding chest pain, declining testosterone, neurological issues, like early neuropathy from diabetes, or significant psychological stress. Research, such as a pivotal 2021 study in the American Journal of Medicine, reinforced that erectile dysfunction, ED, including diminished morning erections, is a strong independent predictor of future cardiovascular events, often appearing years before other symptoms. I recall Ray, a sharp 72-year-old. He hadn't experienced a morning erection in over a year, dismissing it as inevitable aging. During a checkup, prompted by this absence, we investigated further. Tests revealed early-stage arterial blockages, cardiovascular disease we caught before it caused a heart attack or stroke. Intervention was possible because he finally acknowledged the signal. Paying attention to this isn't about chasing youth, it's about understanding your body's language. When men start recognizing these signals and acting on them, like consulting a doctor, they shift from feeling passively aged to actively managing their health trajectory. It's a powerful step towards reclaiming agency. Moving from observation to action, your daily shower routine holds surprising potential, both for benefit and unintended harm. Let's refine this everyday ritual. Step 5. Cleanse with care. Gentle hygiene matters. For most of my life, and indeed for many men, showering meant strong soap, hot water, and vigorous scrubbing, a get clean at all costs mentality applied uniformly. However, years of clinical practice, seeing men present with persistent irritation, rashes, or infections, illuminated a crucial truth. The penile skin is uniquely sensitive and demands a different approach. The genital skin is thinner, more delicate, and hosts a delicate microbiome, a balance of beneficial bacteria and natural oils, sebum, that protect against harmful pathogens and maintain skin integrity. Harsh antibacterial soaps, scalding water, and aggressive scrubbing strip away these protective barriers. This disruption leads to dryness, irritation, microscopic cracks, inflammation, balanitis, and ironically, can create an environment more susceptible to infections like yeast, candida, or bacterial overgrowth. Studies in contact dermatitis, including a 2020 review in Clinical Dermatology, consistently show that the genital area is highly prone to irritation from common surfactants and fragrances found in many soaps. Overwashing, particularly with inappropriate products, is a frequent culprit in chronic genital dermatosis in older men. The shift is simple but impactful. Gentle is key. Use lukewarm water, not hot. Choose a mild, fragrance-free, pH-balanced cleanser, often labeled for sensitive skin or intimate use, or simply use plain water. Avoid harsh exfoliants or loofahs on this area. Apply cleanser sparingly with your hands, lather gently, and rinse thoroughly. For uncircumcised men, gently retract the foreskin to rinse the glands and inner foreskin with water only. Soap residue under the foreskin is a common irritant. Pat dry gently with a clean towel. Avoid rubbing. This isn't about being less clean, it's about being smarter about cleanliness. It respects the skin's natural defenses. Think of it like caring for fine silk versus denim. This mindful approach during your shower, treating your body with consideration rather than force, fosters a deeper sense of self-respect that carries through your day. It's a small act of daily dignity. Now that you're clean and your body is awake and circulating, what you choose to eat for breakfast plays a direct, often underestimated, role in your urogenital health. Step 6. Fuel wisely, a penis-healthy breakfast. My own breakfast habits for years mirrored a common archetype. Quick, convenient, often heavy on processed carbs, saturated fats, bacon, sausage, and sugar, sweetened cereals, pastries. The connection to my pelvic health seemed non-existent. However, deepening clinical knowledge and personal experience revealed the profound impact of that first meal. What you eat directly influences inflammation levels, blood vessel health, endothelial function, hormone production, especially testosterone, insulin sensitivity, and prostate health, all fundamental to erectile function, urinary flow, and tissue vitality. The typical Western breakfast, high in refined sugars, processed meats, nitrates, saturated fats, and low in fiber, actively works against these systems. Saturated and trans fats contribute to arterial plaque, impairing blood flow. Excess sugar spikes insulin and promotes inflammation, damaging blood vessels. Low fiber intake negatively impacts gut health, which is increasingly linked to systemic inflammation and hormone metabolism. Conversely, specific nutrients act as powerful allies. Nitrates, found in beets, leafy greens, yes, even at breakfast, convert to nitric oxide, a potent vasodilator crucial for erections. Omega-3 fatty acids, walnuts, chia, flax seeds, reduce inflammation and support vascular health. Antioxidants, berries, deeply colored fruits, combat oxidative stress damaging blood vessels. Zinc, pumpkin seeds, oats, is vital for testosterone production. Fiber, oats, whole grains, support stable blood sugar and gut health. Recent nutritional science, like findings presented at the 2023 International Conference on Nutrition and Health, emphasizes the immediate and long-term vascular benefits of a breakfast rich in whole foods, fiber, and healthy fats. My own breakfast transformed: oatmeal topped with walnuts, chia seeds, and blueberries, perhaps with a side of scrambled eggs with spinach or whole grain toast with avocado. This provides sustained energy, essential nutrients, and actively supports pelvic circulation and hormonal balance. Thomas, 68, experienced this firsthand. Skeptical but willing, he swapped his bacon and white toast for oatmeal with nuts and berries. Within a month, he reported noticeably improved morning erections and urinary flow, stating, "Doc, I never thought breakfast could make a difference down there. But it does." Choosing foods that support your entire system, including your pelvic health, is a powerful act of self-care. It fuels not just your day, but your long-term vitality and function. This nutritional foundation amplifies the benefits of all the previous steps. You've inspected, hydrated, stretched, observed, cleansed gently, and nourished your body. Now, a seemingly unrelated habit, how long you sit after breakfast, has a surprisingly direct impact on everything you've just accomplished. Step 7. Break the sit-move after you eat. I vividly recall the growing stiffness in my hips and lower back after leisurely breakfasts spent sitting with the newspaper. Initially brushed off as just aging, the connection became undeniable through both research and patient experiences. Prolonged sitting, particularly after a meal and compounded by the natural circulatory slowdown of sleep and aging, is detrimental to pelvic health. When you sit for extended periods, you compress the pelvic region. This restricts blood flow to the genitals, bladder, and prostate, and increases pressure on the pelvic floor muscles, the crucial hammock-like structure supporting your bladder, bowel, and contributing to urinary control and sexual function. Reduced blood flow starves tissues of oxygen and nutrients, contributing to atrophy and impaired function. Pressure on the pelvic floor can weaken it over time, leading to stress urinary incontinence, leaking with cough/laugh, or pelvic pain. Research, including a significant 2021 meta-analysis in sports medicine, confirms that breaking up sedentary time with brief bouts of light activity significantly improves vascular function and reduces markers of inflammation systemically, with particular benefits noted for pelvic circulation. The solution is elegantly simple and requires no special equipment. Move within 30 to 60 minutes after breakfast. Set a timer if needed. Get up and walk for 5 to 10 minutes. It doesn't need to be a power walk. A gentle stroll around your home, out to get the mail, or even pacing indoors suffices. This movement reactivates your circulation, pumping the blood back through the pelvic area, relieving congestion, and delivering fresh oxygen. It gently engages and supports the pelvic floor muscles. It aids digestion and helps regulate blood sugar. The cumulative effect, as reported by patients and experienced personally, is profound: reduced pelvic heaviness or discomfort, improved urinary control throughout the day, better erectile quality, less lower back stiffness, and an overall feeling of lightness and readiness. One patient, Frank, 70, summed it up: "That 5-minute walk after my oatmeal? It makes me feel like my body is actually working again, not just getting old." We are not designed for prolonged stillness. Incorporating this small, post-meal movement habit counteracts the stagnation of sitting, protecting the vitality and function of your entire pelvic region. If you've stayed with me through these 7 steps, I want to express my sincere gratitude. Thank you for investing this time in yourself, for pushing past potential discomfort to prioritize your well-being. That willingness to listen, to care, is the bedrock of everything we've discussed. For many men entering their 60s, 70s, and beyond, focusing on genital health can feel unimportant, embarrassing, or a surrender to aging they'd rather ignore. But I've witnessed, time and again, the transformative power of shifting this perspective. The 7 morning practices, the mindful inspection, hydrating before urinating, the brief pelvic warm-up, acknowledging the morning erection signal, gentle cleansing, choosing nourishing foods, and breaking up sedentary time. These are not grand medical interventions. They are quiet, consistent acts of self-respect. They are a daily dialogue with your body, a way of saying, I see you, I value you, I am invested in your health. Each small action reinforces the others, creating a powerful cumulative effect on circulation, tissue health, nerve function, and hormonal balance. This isn't about chasing an impossible ideal of youth. It's about optimizing the health and function you have right now. It's about preserving your independence, the ability to travel, enjoy hobbies, be intimate, use the bathroom confidently. It's about safeguarding your dignity. I've sat across from too many men who believed significant decline was inevitable, only to see them rediscover strength, function, and a renewed sense of control through simple, consistent changes like these. It wasn't magic pills. It was mindful attention and action. Perfection isn't required. Start with one step that resonates. Master it. Then add another. Your body possesses an incredible capacity to respond to care. Improved energy, more reliable function, greater confidence, and a profound sense of being actively engaged in your own vitality. These are realistic outcomes. Your health, your confidence, and your control are not relics of the past. They are living aspects of your present, waiting to be nurtured. You possess the power to significantly influence your trajectory. The most important step is deciding that you are worth the consistent, gentle effort. If this perspective shift towards proactive self-care makes sense to you, consider sharing it. Many men struggle silently with these concerns. Your openness could empower a friend, brother, or father. Let me know which step you connect with most, or what questions arise. Your experiences guide how we can better serve men's health needs. If this approach feels valuable, please give it a metaphorical thumbs up. It signals that focusing on practical, dignified self-care matters. Subscribe to stay connected with resources dedicated to your ongoing well-being. Remember, you are absolutely not alone on this journey towards sustained health and vitality. The power to make a meaningful difference in how you feel, every single day, starts with these simple, respectful morning choices.